So often the doctor is going to recommend that you have a nurse come out. I would say nursing is recommended to be the first group that comes out before anybody else. Sometimes you'll have a physical therapy only case, but typically your registered nurse is going to come out and do his or her assessment. So when you're looking at that assessment, it's actually called an OASIS, and it's a very comprehensive test and intake form that looks at everything from your digestive habits to your cardiac history to your skin quality to your strength, everything that you can imagine that would be associated with every system in your body is going to be placed on a form, and it'll be it's a series of tests, and it will spit out a score. So then it will make its own recommendation on whether or not you would benefit from having the entire team come out, that being the PT, the OT, the speech therapist, the social worker, and the home health aide. Sometimes, regardless of that test, the doctor will have made his or her own recommendation on who all needs to come out and be in the home. And then we pretty explicitly go by that unless there's some need that we see that wasn't met. And then, either way, we're going to do that assessment and call the physician and let them know. We have a little conference that we have with them so they know what's going on. And so really it's nice because everybody that is going to come into your home is going to be on the same page with what's going on with your care. Every company should have one. I know the best companies will have a weekly case conference to really just be on the same page with what's happening, and so we can better help you that way. But anyway, so I've digressed a little bit, but we're talking about how the case is set up. So the registered nurse will come out, and he or she will set how many times a week the next nurse that will come out. That person could be a licensed practical nurse or a registered nurse. Either way, they both give excellent care, and so that person may come out once a week, twice a week, however many times, just based off what the physician has ordered for you to have. And then they will be coming out. They'll be taking all of your vital signs each time they come, and that's going to be physical therapy and occupational therapy as well. They're going to take blood pressure, they're going to take your pulse, they're going to take your respiration rate, and they're going to take a temperature. And they will be taking that each time, and they should be writing it out in a little book that they will give you when we first come that tells you all about what it is that we do, and it's got a bunch of goodies in it with phone numbers for all kinds of government services. It will give you the agency's home base phone number. It's going to tell you about what to do in case of a disaster. But anyway, it's a standard package that you should get from pretty much any home care company that comes out. So the nurse comes out. Specifically, they do a lot of disease education, so you better understand if you've got diabetes, congestive heart failure, stroke, fracture. I mean, the list goes on and on. But whatever is going on with you, they're going to come out and they're going to teach you about it. So you know what you can do for yourself in terms of positioning, what medication you're going to take, if you're going to have the nurse come out and give you a shot, or whether or not you're going to be administering your own medicine. If you have diabetes, they're going to be teaching you how to use a glucometer and how to, really, test yourself and make your own records so you understand when the nurse finally, does pull out it's when her time is up or his time is up, that you understand how to take care of yourself. So if they do anything from wound care to medication teaching, they may set up an IV. Nurses wear many hats. I love working with nurses. They do a lot and they know a lot, and they provide care in the home that is, most of them that are really exceptional are also providing a good conversation and just a lovely visit. So I'm very pro nurses.